Is that displaying okay?
Yes, that's good, thanks.
Okay.
Okay. Hello. Good morning.
Hey,
Over to you.
hello everyone. Good morning, good afternoon, good
Good
night.
afternoon. You're muted again. Please unmute. There we
Hi.
go.
Okay,
Yes.
I'm Alosio Tagiilima from Samoa. I'm a registered senior environmental officer working under the public health. So for today, I would like to thank PacMOSSI for allowing me to present on this amazing platform, the annual meeting. And of course, Dr. Edgar for the opportunity through the PacMOSSI mentoring program. For today, I'm going to present on the dengue situation in Samoa and what we are doing as a vector control unit and Samoa's vector control response to our current outbreak. Next slide, please. That's the content for today. Next slide. So from the month of January to April, we have a total of 35 cases. You can see the jump on cases from the 330 in March, and then the 29 cases of April. So yes, it's a massive jump. On the 17th of April, we declared another outbreak, which is a double outbreak. Last year was our last outbreak, and yeah, it's not something you can easily control without having the team all together with the help of experts. Next slide, please. This is a summary. All this information you can also access on our Government of Samoa page. The information that the current outbreak was declared on the 17th of April, 2025. That's the same date we call the integrated vector control meeting for this year to talk. It's a multi-sectoral meeting with the Ministry of Health partners on planning on implementing control programs for dengue cases. We have sent one case to New Zealand for serotype testing, and we received it is a serotype 2 10v2 virus that has been circulating in the start of April. The most affected age group was from the 15 to 19 years of age, which are children, and the majority of dengue cases are around the regions of European area and northwest to Bolu. So one of our control response that are in the National Strategic Plan is the indoor and outdoor residual spraying. Our first priority is to spray all the cases from January to April. All the cases with valid phone numbers, complete contacts, and we had to conduct environmental assessment of properties, make the families aware on prevention and dengue transmissions. After we conduct the indoor and outdoor residual spray. As you can see, the last bullet point was our last outbreak, and it's from the 19th of April 2024, ended on August, and then we just declared there's a new outbreak this year on the 17th of April, so it's a double outbreak. Next slide, please. As you can see on the map of Upolu, all of the cases from January to to April are in the Apollo Island. You can see all the districts of the districts where cases resides, and those areas are, or those regions are the urban area region and the Northwest Upolu, just the most affected regions of Upolu and all those districts. Next slide, please. And then we come to our, this is the control response that the ministry and with multi-sector collaboration with partners using the strategic plan, and of course our IVCC committee. There's in Samoa we have a integrated vector control committee. That committee is chaired by the Ministry of Health. We have consist of partners from relevant government ministries and organizations such as WHO and other independent stakeholders. So yeah, our response is the press release on the date that we declare the dengue outbreak. We have ongoing risk communication from our health promotion division specifically on source reduction and preventative measures on all social media platforms, TV, radio talk shows, dengue advertisements on TV. We have a Facebook page. We have a program on our Facebook, on the Ministry of Health Facebook page for the health of the nation. We use that platform to reach the communities. We also utilize our government programs within the community and empowering villages to raise awareness on preventing dengue at the grassroots levels. And then there's our most important of all, the integrated vector control committee. Yeah, we have to implement strategies within our national strategic plan, advising our partners, other government ministries on using their context as a ministry to provide programs from their end on preventing dengue and having dengue prevention programs prepared and implemented. Next slide, please. And also within our national strategic plan, we have that we have to conduct indoor and outdoor visitor spraying for our members, our core members, and our partners, the IVCC members partners. You can see we have conducted training from last year to April. And also thank you to my mentor Rod and Dr. Amanda. They have participated in some of the trainings that we conducted last year in the ports of entries, which is our Samoa Airport Authority and the Samoa Ports Authority, where the wharf is. And we also conducted on trainings on other pest control companies that are applying for business license. Next slide, please. Yeah, on all our media outlets, this information is on all our media outlets, with social media, the press release. We have provided this information for the people to make aware of what dengue is and what to prevent yourself from getting dengue. And yeah, the spray is not doing too much, and source reduction is the one vector control that we are promoting daily to make people aware of how to protect yourself from dengue by eliminating breeding sites, which is the very source of mosquitoes. Next slide, please. During our outdoor residual spraying, we have conducted spraying for schools within the Northwest Upolu in the urban area, and all the families that have affected with the dengue virus and the cases. And also thanks again to Rod, my mentor. He has been very helpful for the current outbreak on giving us tips on where to spray, including spraying inside bromeliad plants, and most of the breeding sites are general rubbish, solid waste. Yeah, to spray all of that and not just around the house and in the areas. Next slide, please. Yes, that's our team. It's we also promote that gender equality stuff. Yeah, that's when we use the ladies for the indoor residual spraying. All of our staff have been trained by me and my former mentor, my former boss, Fata Paulo, as all of you know. Yeah, we last year we trained our staff locally, especially the ladies that can carry the CRISPR spray for indoor residual spraying. Next slide, please. These are the two chemicals that we're currently using, and we've been using for the past 5 years. It's the Icon 10CS and the chlor-PCO. These are both pyrethroid chemicals. One is the lambda-cyhalothrin and one is bifenthrin, which are both pyrethroid chemicals. Next slide, please. And that's it. Thank you very much for listening. Yeah, and then you can see again, I have this lady. This is our hardworking secretary at the front. And again, we promote having a ladies spray. Thank you.
Thanks, Alosio. Have a day.